Preventing heart disease. Welcome to this film, which was made as part of the Queen's Nurse Development Programme with a grant from the Burdett Trust for Nursing. The aim of this short film is to raise awareness of heart health and to reassure you that it is never too late to improve it for the future. These are some of the ideas that inspired the film. What is good for your heart? What would be good for you? Is it too late? Simple exercises that can be done in a cell. Incentive to make a change. How to take your pulse? Exercise with like-minded folk. Have you ever wondered what we all have in common? All of us has a beating heart that we need to take care of. As many as 1 in 5 people in Scotland live with heart disease, which can increase the risk of stroke, lung disease, or poor circulation. You can make a difference to your own heart health. Let's start with diet. Adults need between 2,000 and 2,500 calories per day to maintain a healthy weight. A donut can contain about 200 calories, whereas an apple has around 77. Healthy eating choices can be a challenge, and eating a balanced diet is not always easy. However, try to eat fruit and vegetables each day. Can you guess how much sodium is in a bag of crisps? It's 340 milligrams. 2,000 milligrams of sodium is the recommended daily limit for an adult, which is equivalent to almost a teaspoon of salt. So how much are you shaking on your chips? Too much salt can contribute to heart disease and high blood pressure. So be mindful of what you are eating. Limiting salt, sugar and fat is essential, but not much fun when boredom can make it easy to eat for comfort. However, reducing foods that are high in all three can help in the long run. Try to keep track of your waistline. Elastic waistbands can allow silent weight gain, so regularly check how your clothes fit. Improving dietary choices can be a challenge, but just making one change at a time can help. Be proud of yourself when you succeed. Remember, the menu options are colour-coded, green, amber and red, to help you choose healthier meals. What about smoking? It's harmful whether it's tobacco or other substances, and your lungs can become damaged as a result. Did you know that e-cigarettes are just as addictive as others because they also contain nicotine? But they can be a good substitute for stopping smoking. Aim to eventually cut those out too if you can. Can you exercise? There are several options if you're in a confined space, either seated, lying on a bed, or against a wall. Everyday items can be used as weights, and resistance can be achieved by using your own body weight against a wall or floor. Going to the gym or walking outside are the best forms of exercise. However, not everyone is comfortable with this, so physical activity in your own space can help. Only do what you are comfortable with, and build up slowly if this is new to you. Do you know how to take your own pulse? The aim of activity is to increase the heart rate for 20 to 30 minutes at a time, working not only your biceps or quads, but the heart muscle too. Most people will have a resting heart rate between 60 and 100, and learning to take your own pulse, feeling where the heartbeat pulses on the underside of the wrist, is a great way of being able to self-monitor or identify any changes which may occur. Practice taking your pulse by placing 2 fingertips on the groove on the underside of your wrist, below the base of your thumb, and you will learn to recognise your own heart's pattern. You can then try star jumps or other exercise and take your pulse again and see how it changes. This can help with self-monitoring, and you can write down your results. Have you ever experienced chest pain? Not all chest pain is directly from the heart, and anxiety, stress or worry can cause the chest to feel tight. When this happens, it can raise more anxiety, resulting in more pain and fear that you're having a heart attack. Using relaxation techniques to manage stress can be helpful, and information is available to help you with this. So, to summarise, keeping a healthy heart can be a challenge, but it's not impossible. Can you reduce your salt, sugar and fat intake and try to eat more vegetables? Set yourself a goal to enjoy fruit as a healthy alternative to sugary snacks. What about reducing nicotine intake by using fewer e-cigarettes? And finally, challenge yourself to exercise enough to increase your heart rate, flex your heart muscle and improve your stamina. Feel empowered to look after your own heart health and take control of what you put in your body. We only get one heart, so make the most of it. Thank you to the QNIS and Burdett Trust for Nursing and everyone who supported production of the film. It would not have been possible without creative ideas of the prisoners in HMP Grampian YOI. For this I am truly grateful.